All right, folks, we're going to get started, and I think some more people will join as we go, but happy to be here, happy to answer some questions on COVID-19, influenza, RSV, other respiratory viruses as we head into the fall. So I will check in on the chat and pay attention to questions as we go, but just some general remarks to get us going here. Again, thank you for joining. I'm calling in here from Treaty 20 territory of the Mississauga Anishinaabe. So I'd like to honor the land and waters where I'm calling in from and we're gathered today. And wherever you are across Turtle Island, I hope that you pay particular respects this week, especially as we are mindful that this is a Truth and Reconciliation Week. And Saturday, September 30th, is National Truth and Reconciliation Day. So just wanted to note that first, and particularly of relevance as we talk about the vaccine and viruses. I want to acknowledge that there's a disproportionate burden that Indigenous peoples across Canada have faced, and Indigenous peoples have been a prioritized group as part of the response to COVID-19 and other viruses, and that is really important from a health equity standpoint. So thank you for joining, and wherever you are, I hope you can find a cup of tea or a glass of water and sit down, and we'll have a chat together about what we might expect this respiratory season and what you can do perhaps to protect yourselves, your family, those you love, and how we can stay a little bit healthier this fall. Some of you may already have been sick. In fact, we're seeing a lot of transmission of viruses. And this week on Wednesday, the COVID-19 risk index went up from moderate to high risk. That means we're seeing more transmission, more virus in the wastewater, more people testing positive for COVID-19. And of course, there are other viruses out there, though none of them really, we're not seeing as much transmission as we are with COVID-19 yet. We anticipate as we go through the fall, we'll also see influenza start to pick up, RSV, other viruses, but that's likely going to be a little bit later. Usually influenza really starts picking up in the new year, and RSV would be a little bit later this fall. So if you haven't yet, I encourage you to check out the risk index, and that can be found on the Peterborough Public Health website, linked directly from the homepage, as well as from Google. You can Google it, Peterborough Public Health Risk Index. And new now, I would encourage you to check out, we have a sign up. You can sign up for a weekly update email on the Risk Index website if you're interested in getting that delivered to your inbox every Wednesday at 5 p.m. And so today we're going to talk about these viruses, about the vaccine, some things you can do to protect yourselves. And hopefully this is useful, and then I'm happy to take any questions you might have as we head into the fall. So a few more comments on the current context. So we're seeing obviously more transmission, the risk index going up to high. We did see the first case in the region of the BA 2.86 variant, which at this stage, we don't have evidence that it is more severe, causing more severe illness, but we do have evidence that it's quite transmissible, and perhaps we will start to see more of this and other COVID and other viruses as we go through. So when we look at the COVID-19 risk index, you can see that we're at high this week, and you can see all of the data on our homepage here. I'll just show you it briefly, but you can see here's the main page with the COVID-19 risk index. You can see high, we're at low for other viruses. And if you go through here, you can see the other data points, including importantly, the increase in the wastewater surveillance. And so if we zoom in right here, you can see through most of the summer, it didn't go down to none. We still had transmission of COVID, but really September and in the last week especially, we're seeing quite a significant increase in transmission. And so what does that mean? Well, certainly we are in many ways in a better place than we've been in the last 3.5 years of the pandemic, coming up on 4, can you believe it, in early next year. But in some ways, I think we've moved on and we're not thinking about some of the things that we can just do to keep ourselves healthy, safe, and prevent transmission. On the Risk Index website, you can see some guidance and suggestions. So what are we talking about here? A lot of the same things that we've learned through the COVID pandemic that are helpful are still helpful. That includes ensuring you're up to date on vaccines. We'll come back to talking about vaccines shortly. and other measures that you can take. One is ventilation, improving indoor air quality. You can do that in a variety of ways. If you're in an indoor space that's got a lot of other people, trying to make sure that your HVAC system, your furnace, your air circulation is high, you're bringing lots of outdoor air in, and that can decrease the risk of transmission of these viruses. You can also open a window, open a door, get air circulating, or use one of these in-room air filters that can help as well. So ventilation is important. One thing we've learned through the pandemic that's important that perhaps we're not as in good practice of now is staying home when you're sick, right? The same period of 10 or 14 days isolation doesn't apply as your symptoms start to get better. It is certainly okay to be going back to work, to school, but for the 5 days afterwards, the recommendation really still is you should be wearing a mask, and that's important to prevent transmission to others. We don't want to make others sick, right? And on the mask front, that can be helpful for you too. And I know lots of folks have dropped wearing a mask in the last little while, but as the risk goes up this fall, and we see ourselves at high now, you might want to start thinking about wearing a mask inside again. And I do just want to mention the N95 or KN95 style mask. You can get those. They're a lot cheaper than they used to be. And they are more effective in transmission prevention. So masking inside is helpful. And many people say, oh, no, I'm done with that. I'm not going to mask anymore. And I just say, maybe even if you're not going to mask frequently or all the time, masking sometimes is helpful. You'll need to do that if you're in healthcare settings, some settings where it's still required. But in other settings, you might just want to think about if there's lots of people indoors, if you're concerned about the ventilation, it's something you can do, others can do to prevent the transmission, and it's worth thinking about. Masking some of the time is better than none of the time, and I know that will be challenging, but we're thinking about this fall as we protect ourselves, and especially as the risk continues to kind of increase. Nobody wants to be sick, and these are things we can do. Let's talk vaccine. That's the next most important thing. So just today, we heard that the Pfizer vaccine is approved too. So the Moderna and Pfizer XBB vaccines are whole new vaccines. We wouldn't classify them as boosters anymore. And so some people I've sort of heard, I don't need another booster. I did have one last year or at some point. This is a new vaccine. It's targeting a whole new strain, the XBB strain. That's in the Omicron family of viruses, and the strains that are circulating now are close descendants. So we think this vaccine will provide better, improved new protection. So certainly if you haven't had a dose in the last 6 months or a confirmed infection, it's worth thinking about as you're able and eligible to get vaccinated. The guidance is that it will be approved, and folks 6 months of age and older are eligible to receive this vaccine. It can be for the primary series if you're somebody who's never had a vaccine dose before, perhaps if you're young, or it can be for an additional dose. Similar to every year, we have a new flu shot tailored to the circulating strains, and it's kind of a whole new vaccine, not just a booster. And similarly, that's what we've got with the COVID vaccine, these two XBB vaccines that are approved. Now, the provincial approach is starting with priority populations. So that will mean the timeline will be we've actually received these vaccines in region. We're starting to roll them out now to hospitalized individuals, staff, long-term care and elder care lodge residents and staff. And then the next eligible group, as we have enough vaccine and those folks have received, it will also go out to individuals at high risk of influenza, COVID, and those include people in residents and staff in other congregate living settings, things like we talk about retirement homes, chronic care facilities. It'll include pregnant individuals, people who are 65 years or older, children 6 months to 4 years of age for influenza especially are prioritized, and individuals who are Indigenous. Then we'll also be thinking individuals who have medical conditions that put them at risk of severe disease, who may be immunocompromised or at higher medical risk, and other members of racialized or other equity deserving communities will be prioritized as well. In that second group will be healthcare workers and first responders. And then finally, for the general public, right after that second group, as soon as supply allows, we will start the general public administration. And we don't know exactly when that will be. It will be a number of weeks still away, likely, perhaps later October, November, by the time that does start. But it will somewhat depend on supply. So, that's a little bit on the COVID vaccine. The influenza vaccine is also going to be available similarly in a phased rollout, and you'll see it coming to primary care, your family doctor, or your pharmacist very soon. And there are some other clinics. So with all of this, if you want to know where can I get my vaccine, you can visit our Peterborough Public Health website. We've got info there on sites, places for both COVID and influenza. And again, while we're waiting, other preventions are important. So while you're waiting for your dose, continuing to take precautions to try to prevent spread is important for these viruses. We've received some questions, and I'll go through them. And then if there's any questions online, happy to take them. The next piece, though, I want to talk about before that is the RSV vaccine. Now, that's new and a really exciting leap forward in science with a new vaccine that is approved in Canada. In Ontario, actually, is taking the lead with one of the only publicly funded vaccine rollouts for RSV vaccine, and that is focused on the highest risk population that's eligible for this vaccine. So the RSV vaccine, the new RSV vaccine, has just been approved in people 60 years and older. And for those that are in long-term care, retirement homes, or other senior congregate living settings, there will be eligibility, and those details will be shared through those settings directly. Now, there won't be public availability of the RSV vaccine this year. This is an initial rollout of a new but very well tested, very safe vaccine. And in future years, I would imagine there may be other groups that may become available, but right now it's only authorized for people 60 years and older, and it's only publicly funded for those in those highest risk settings, such as long-term care, retirement, or other living facilities for seniors. And so for other people, it may be something that you may want to consider if you're in the age group but not living in one of those settings. However, it won't be publicly funded. You will have to pay out of pocket for that, and you can probably get details from your primary care provider or your pharmacist if you're interested, and that might be important protection to consider if you can afford to or have coverage to pay for that medicine. So unfortunately, this year it's not available to other populations like infants because it's not authorized in that age group, but we will see what will happen into the future. And there still is pavlizumab, which is another treatment for high-risk premature infants. So for those who are in that category, the hospitals usually connect to get infants those vaccines. So that's something to think about. Some questions we've received. There's somebody who wrote in and said, I am pregnant with my first child and I'm worried about RSV. What can I do to prevent my child from getting RSV? So again, that person wouldn't be in the group that would qualify for the vaccine, at least not this year. So we'd suggest other preventative measures. Some of the same things we talked about for COVID influenza can be really helpful and important. Trying to avoid a gathering with people who are sick, ill, who have symptoms. You can mask up when you're around others and when others are around your newborn, and you can take other precautions and ensure generally that your child receives all of their other immunizations, because there's other viruses and illnesses that those childhood immunizations that protect against, and those are really important. Some other questions we've received. One was, my mother is 68. When can we expect her to get the COVID and flu vaccine? So I think I would have already covered this a little bit earlier. So in response to that question, they'll be in the 65-year plus group unless they're in the first group, which is those living in long-term care or other places like that. they'll be in the second tier of high priority groups. And so as soon as that first group's done, hopefully in the next little while here, few weeks, they would become eligible and they can get the protection from their COVID and flu vaccines. And you can get info on where to schedule and get that from our website or from your family physician, primary care, or your pharmacist. Those would be places to look. And we do have some public health clinics as well. So there's another question. If I don't want to wait for the monovalent COVID vaccine, can I get the bivalent as an additional dose now? So the National Advisory Committee on Immunization for the summertime has been saying, if you haven't had the bivalent yet, we now suggest waiting for the new dose. And so that new dose is here. It's just a matter of days to weeks now until people will be able to get that vaccine if they haven't already. And so the suggestion likely is to wait and to get the new XBB dose, and you can take other preventative measures to protect yourself in the interim. Now, you are technically allowed, if you want to get the bivalent booster. Some still have it available. So that could be something that you get if you really are anxious to get the protection now and you're not able to get the XBB booster. But you can make a decision potentially in collaboration with your primary care provider if you have questions. And so there you go. We've got some people on the line, and I've made it through all the questions we got beforehand. Any questions at all? Vaccine, COVID, flu, RSV, other viruses. I am here. We are here if there's anything that we can help with. And otherwise, hope your September is going well and that you're not sick. I sure hope you're not sick and you can stay healthy as we go through this fall. So I'll hang out, and I don't see any questions coming in yet, so keep an eye out. And if there's anything I can help with, I'm here and happy to help. You may have already answered, will the flu shot and COVID shot be in the same vaccine or separate? So I see a question there in the chat. This year, they're in separate vaccines. I mean, maybe one day into the future, we'll be lucky enough and you can get one vaccine, but right now there'll be different vaccines, so to be kind of a one in each arm sort of situation. Not everywhere will be able to offer both at once. Some sites, some pharmacists, some places definitely will be able to offer a one in each arm, COVID, flu, both at the same time, and they're completely safe to get at the same time, but they're different vaccines actually. While I'm on that, a question that did come up was around the RSV vaccine, and so the guidance for it is it should be 2 weeks before or 2 weeks after the COVID and flu vaccines, but that's okay for those that are part of the publicly funded program in the long-term care type settings. The folks working in those facilities will know and understand that guidance. And the likelihood is RSV won't be available for a little while anyway. So, as we speak, the rollout is started in the first group. In the next little while, hopefully a couple of weeks, we'll be moving on to the second group of high-risk folks living in the community. And I did mention those groups, but it's also available on our website and the provincial website about the vaccine. And then the general public will be in the third group available. And as vaccine supply allows, we'll be moving our way through those groups and try to get it out to everyone as soon as possible. All right, I'm seeing some thanks and some thank you, and that's great. I appreciate you joining. Hopefully it was helpful. And if you're listening to the recording, feel free to send us some questions via social media. We'll do the best to support. And your primary care provider or your pharmacist, also great sources for questions as you think about getting the vaccine and getting protected this fall. COVID, influenza, potentially RSV for those in the public funded program. And certainly let us know if we can help further and if there's any other questions. Thanks so much and have a good evening.